The monitor behind bed 2 was already climbing, and nobody in the room had noticed yet. Nurse Karen Whitfield crossed straight to the second bed, chart already in hand, eyes on the paper instead of the patient holding it together underneath her. You rang twice already, she said. I did, Marion told her. My pain medication was due at 11. It's almost 1. And I need you to look at that monitor, not the chart. Whitfield glanced at the screen from 3 feet away, barely long enough to actually read it. It's on the schedule. You'll get it when it's time. My heart rate's been climbing for 20 minutes, Marion said. I've read 1,000 monitors exactly like that one. Someone needs to page cardiology. Something in that landed wrong, and Whitfield almost smiled. Ma'am, I've got 11 other patients. Let's not make this dramatic. I'm not being dramatic, Marion said. I know exactly what I'm looking at. Whitfield was already turning for the door, fluffing Margaret's pillow without breaking stride. It's fine. It does that sometimes. The door swung shut behind her. Marion turned back to the monitor alone. Someone will look at that number eventually, she said quietly, to no one. On the screen behind her, the number ticked up by 1. 90 minutes later, the room looked nothing like it had 15 minutes earlier. Dr. Elijah Bennett crossed to the bed at a run, chart already open in his hands, and stopped cold the second he actually saw her face. Dr. Hayes? Nothing about the years since had changed her enough to be unrecognizable to the resident she'd once made. Rescrub a case 4 times. He didn't wait for an answer. How long has her heart rate been elevated? He asked, sharp, already reaching for the leads himself. She seemed stable, Whitfield said, her voice gone very small.
This is Dr.
Bennett
Marion
still
Hayes.
didn't look up.
This is Dr.
Marion Hayes, he said. She ran this hospital's cardiac service for 22 years. The room went completely still. Before we dive deeper, let us know in the comments where you're watching from. We'd love to hear from you. And don't forget to hit that subscribe button so you never miss any of our upcoming videos. Nobody on that floor knew her name. Not the nurse who wouldn't look at her monitor. Not the aides who walked past her call light without a second glance. It took 2 days for that to nearly cost her everything. And by the time anyone found out who she actually was, it was almost too late to matter. So here's what you need to be asking right now. Who is the woman in bed 2, really? And why does she seem so certain about a number nobody else will look at twice? Why does a nurse with 19 years of experience trust her own instinct over a patient telling her, plainly, what's wrong? And when the truth finally does come out, will it come out in time to matter, or just in time to explain what went wrong? This is a story about what happens when the person nobody bothers to really see turns out to be the woman who built the very floor they're standing on. This is where it started. In 1979, Marion Hayes was one of 4 black women in her entire medical school class, at a university that had only stopped arguing about whether to admit any at all 6 years earlier. She was told, more than once, and by more than one attending, that she'd taken a seat that belonged to someone else. She was mistaken for a janitor twice in her first month on the wards, mistaken for a food service worker once during her surgical rotation, and corrected the record each time with the same flat, unhurried patience she would spend the next 4 decades perfecting. It hadn't come easily even before that. Her first application to medical school, 2 years earlier, had been rejected without explanation from a school whose admissions committee later, decades on, would name a scholarship after her. She'd taken the rejection letter to her mother's kitchen table, the same way she'd take every hard thing to that table for the rest of her life. And her mother, a seamstress who had never finished high school herself, read it twice and then said only, "Then you'll ask them again, and you'll bring something this time they can't say no to." Marion spent the following year working as a hospital orderly, of all things, at a county hospital 3 towns over, mopping the same kind of floors people would later assume she still mopped, and used every spare hour studying until the second application came back different. There was one incident during her 3rd year that she never told most people about, not even Renee until she was well into adulthood herself. A patient scheduled for a routine gallbladder procedure took one look at the surgical team assembled around his bed, saw Marion listed as the assisting resident, and told the attending physician flatly that he didn't want that one touching him. The attending, a man Marion had otherwise respected, apologized to the patient and reassigned her without a single word of protest, right there in front of the whole team, as though her competence were a preference rather than a fact. She scrubbed out, changed, and finished her shift on a different service that day. She did not cry until she was home, and even then, only for the length of one song on the radio, because she had learned already, at 26, that there was a strict and unforgiving budget for how long a black woman in that hospital was allowed to be visibly hurt before it started counting against her instead of for her. She chose cardiothoracic surgery not long after that, because, as she told Renee years later, it was the specialty with the least room in it for anyone's opinion of her once her hands were actually inside someone's chest. A heart doesn't care who's holding it steady. It only cares whether the hands are good. They were good. Better than good. By the time she was 40, Marion Hayes was running a surgical service at Ashford Memorial that other hospitals sent their hardest cases to, the ones nobody else wanted to attempt. She trained 11 chief residents over the course of her career, 3 of whom went on to run cardiac programs of their own. One of them was a nervous, brilliant young man named Elijah Bennett, who she once made rescrub for a case 4 separate times because his technique on a valve repair wasn't yet the technique she required from anyone operating under her name. "You'll thank me in 15 years, she told him, the 4th time. "I'm not sure I'll survive the next 15 minutes, Dr. Hayes," he said, and she allowed herself the smallest possible smile, the kind she rationed carefully in a building where a woman who smiled too easily got remembered as soft instead of skilled. There was a case, years before Bennett ever scrubbed in with her, that the surgical residents still told newcomers about long after Marion had gone quiet on the subject herself. A 17-year-old boy had been pulled from a highway wreck with his aortic root torn nearly in 2, the kind of injury that killed most patients before they ever reached an operating table, let alone survived what came after. 2 other surgeons had already declined the case as unsalvageable by the time it reached her. She took it anyway, worked for 6 hours with her own hands holding pressure on a heart that kept trying to stop being a heart at all, and sent that boy home 5 weeks later walking under his own power. He named his first daughter after her 20 years afterward, a fact Marion mentioned to almost no one, because she had never done any of it to be thanked. She had done it because the alternative was a boy who didn't get to have a daughter at all. She married Thomas Hayes the same year she made attending, a hospital pharmacist with a slow laugh and no patience whatsoever for anyone who tried to rush her through a decision, medical or otherwise. He used to wait for her in the parking garage some nights until well past midnight, engine running for the heat, just so neither of them would have to walk to their car alone in the dark after a bad case. They had 38 years together before his own heart, ironically enough, gave out on a Tuesday morning while he was watering the tomatoes he'd been fussing over all spring. None of this, the rejection letter, the boy from the highway wreck, 38 years with a man who made sure she never walked to her car alone, was anywhere in the room 2 days into her stay, when a nurse who had never heard any of it walked past her call light for the 2nd time that hour, already certain she knew everything about the woman in bed too worth knowing. Even at the height of her career, running the entire cardiothoracic service, it never entirely stopped. A visiting surgeon from another hospital once addressed his questions about a joint case to her white male fellow standing 1 step behind her, assuming rank in the wrong direction 3 separate times in the same conversation, before Marion finally said, evenly, "You'll want to direct that question to me. It's my service." A hospital donor once asked her, at a black tie fundraiser she'd been invited to specifically as the guest of honor, whether she could point him toward the coat check. She'd pointed him toward it without comment, because making a scene at her own honorary dinner would have cost her more than a moment's indignity was worth, and she had long since learned exactly how that particular math worked out in a room full of people who controlled her department's budget. She retired 8 years ago, at 63, on her own terms and her own timeline, at a small reception in a hospital cafeteria that half the surgical staff attended and the other half claimed to have a conflicting meeting. She didn't mind. She had never done the work to be remembered by the people who needed convincing. She'd done it for the ones who were still breathing because of her. 8 years is a long time in a hospital. Long enough for an entire nursing staff to turn over twice. Long enough for a legend to become a name nobody currently on shift had any particular reason to recognize. Filed somewhere in a personnel archive nobody in Nurse Karen Whitfield's daily rotation would ever think to check. Whitfield had not checked. Right now, 2 days into a stay that still had one more crisis left in it, she was 3 doors down finishing paperwork on a different patient entirely. No more curious about the woman in bed too than she'd been an hour ago. Marion lived alone now, 2 years after losing Thomas, in a house with a garden her daughter Renee kept telling her was too much upkeep for one person. She still read journal articles some mornings out of habit more than necessity. She still noticed, more than she let on, the particular fluttering irregularity in her own chest that had started up quietly a few months back, the kind of thing she would have ordered a dozen tests for in any patient who described it to her. She didn't order the tests. She told herself she would. Eventually, the way people who've spent 40 years taking care of everyone else tend to tell themselves that. The night it caught up with her, she was alone in her kitchen making tea when her heart went from a normal rhythm into something fast and chaotic and entirely without pattern. The specific feeling she'd diagnosed in hundreds of other people's charts and never quite believed she'd feel for herself. She sat down at her own kitchen table, one hand pressed flat against her own sternum, and timed it the way she'd trained herself to time everything. 90 seconds, then 2 minutes, then close enough to 3 that the clinical part of her mind, the part that never fully turned off, started running through differentials whether she wanted it to or not. She called Renee instead of an ambulance, because some part of her still wasn't ready to be the patient instead of the doctor. "Mom, are you sitting down? Are you somewhere safe?" Renee's voice had gone instantly, professionally calm, the exact tone Marion had taught her without ever meaning to. "I'm at the kitchen table. It's irregular. Fast, I'd estimate 110, 120. I need a ride, not a siren. I'm already grabbing my keys." Renee drove her straight to Ashford Memorial. Of course she did. It was the closest hospital, and it was the hospital her mother had built half her career inside of, and neither of them thought twice about walking back through those doors. Nobody in the emergency room recognized her. The resident who admitted her was 26 years old and had started his residency 4 years after Marion Hayes had already gone home for good. He read her intake as atrial fibrillation with a rapid ventricular response, ordered the standard workup, and sent her upstairs to a shared cardiac observation room with the kind of efficient, impersonal courtesy hospitals extend to any patient whose chart doesn't flag them as anyone in particular. If you've ever walked back into a building that used to know exactly who you were and had it look through you like a stranger, you already understand the particular loneliness Marion Hayes felt riding that elevator up to the 4th floor. Elijah Bennett himself had needed Marion more than once during his own residency, in ways that had nothing to do with surgical technique. He'd come up through a program where he was, for 2 straight years, the only black resident on the cardiac service, and Marion had been the one who pulled him aside after a senior attending publicly questioned, in front of an entire team, whether he'd actually earned his spot or simply filled a quota the hospital needed to meet that year. She hadn't offered him sympathy. She'd handed him a stack of journal articles and told him the only answer that would ever actually shut a room like that up was being better than every person in it, every single time, for as long as it took. He'd hated her a little for it that year. He understood it completely by the time he made chief resident. She was placed in the bed nearest the window. Margaret Cole, a retired school teacher, admitted the same afternoon for a similar arrhythmia, had the bed nearer the door. Neither woman knew, in that first hour, how differently the next 2 days were about to treat them, for reasons that had nothing to do with their hearts and everything to do with everything else. Nurse Karen Whitfield had worked the cardiac floor at Ashford Memorial for 19 years, long enough to have opinions about patients that she'd stopped examining, the way people do when a belief gets old enough to feel like common sense instead of what it actually was. Somewhere in her second or third year on the floor, an older colleague, since retired, had told her that certain patients simply tolerated discomfort better than others, that some people's pain complaints ran hotter than the actual injury underneath them, and Whitfield had filed that away as practical nursing wisdom instead of what it actually was. A myth with a 200-year history of getting black patients undertreated for exactly the kind of pain Marion Hayes was reporting now. She'd never once said any version of that belief out loud where a supervisor could hear it. She didn't need to. It showed up instead in smaller, quieter measurements. How quickly she answered a call light, how much benefit of the doubt she extended to a reported number on a pain scale, whose questions she treated as information, and whose she treated as a complaint to be managed rather than answered. Margaret Cole's call light got answered within 90 seconds, on average, over the first day. Marion Hayes's averaged closer to 11 minutes when it got answered at all before the next scheduled round. "Your labs came back fine," Whitfield told her that first evening, when Marion asked again about her pain medication timing. "I think you're managing better than you're giving yourself credit for." "I didn't ask you to grade my performance," Marion said. "I asked what time the order says." Whitfield didn't answer that. She checked Margaret's IV line on her way out instead, adjusting the drip rate with the unhurried attentiveness of someone who genuinely liked her job when the person she liked doing it for happened to be in the room. A young second-year resident named Dr. Sarah Kim caught the tail end of that exchange from the hallway and stood there a moment longer than she needed to, the way people do when they've noticed something they don't yet have the standing to say out loud. She'd been on the floor 8 months, still new enough to be careful about which battles were hers to fight. She'd grown up watching her own mother, a Korean immigrant with an accent she'd never fully lost, get talked over in doctors' offices by physicians who assumed a language barrier where there wasn't one, and some part of Sarah had gone into medicine, specifically to be the kind of doctor who didn't do that to anyone. She'd watched Nurse Whitfield work long enough to like her, mostly. Efficient, competent, good with families. And now she stood outside a door doing quiet math about 2 patients with nearly identical charts and 2 entirely different levels of care, and didn't like the number she was getting. Later that same afternoon, a cardiology consult ordered an echocardiogram for both patients to assess valve function. Margaret's was completed by 3 o'clock. Marion's request got logged, then somehow slipped from the day's schedule entirely. Rediscovered only the following morning, when Sarah Kim, reviewing overnight orders out of simple habit, noticed the study had never been performed and quietly walked the paperwork down to imaging herself, rather than trust it to the queue a second time. That evening, the on-call cardiologist phoned in to check on both patients rather than come up to the floor in person, a common enough shortcut on a busy night. Whitfield gave her verbal report on Margaret first, detailed and specific. Appetite, mobility, exact wording of her latest complaint. Her report on Marion took 11 seconds. Stable, tolerating discomfort, no acute concerns. The cardiologist, trusting the nurse actually present in the room over a chart he hadn't opened in an hour, signed off on both patients without further orders and went back to his dinner. Nobody on that call had lied, exactly. Nobody had needed to. The truth had simply gotten smaller and smaller each time it passed through one more person who'd already decided how much of it was worth repeating. "I just noticed the response times look a little different for bed 2, Sarah mentioned to the charge nurse that night. Carefully, The way residents learn to mention things about staff who outrank them in tenure if not in title. "Whitfield's been on this floor 19 years, the charge nurse said, not unkindly, already moving on to the next chart. "She knows what she's doing." Sarah went back to her own rounds, but she found herself, without quite meaning to, timing things after that. Margaret's light on at 2:14, answered by 2:15. Marion's light on at 2:20, still on at 2:31, when Sarah finally went in herself to check what was needed, since it clearly wasn't going to be checked otherwise. She didn't mention that second timing to anyone. She wrote it down instead, on a sticky note she folded into her badge holder, the way people start keeping their own quiet records once they've stopped trusting the official ones. Whitfield, for her part, would have described her own care that week as entirely professional had anyone asked her directly, and she would have believed it completely while she said it. That was the particular danger of a belief that old. It no longer felt like a belief to the person holding it. It felt like 20 years of instinct, the same instinct she trusted for everything else on that floor, and it never once occurred to her to double-check the one part of her instincts that had never actually been examined at all. She said as much, almost word for word, to a new nursing aide shadowing her that same afternoon, a 22-year-old named Jenna, who'd only been on the floor 3 weeks. "You'll learn to read pain differently once you've done this long enough," Whitfield told her, nodding toward bed 2 without quite looking at it. "Some patients report higher than what's actually going on underneath. You get a feel for who's exaggerating and who really needs it." Jenna nodded along, the way new hires do when a senior colleague hands them something dressed up as wisdom, and wrote nothing down, because it hadn't occurred to her yet that it was the kind of thing worth writing down at all. Not the lesson, but the fact that it had been taught to her as though it were simply how nursing worked. None of this had reached the monitor yet. It was still just a number a few beats higher than it had been the day before, patient and unhurried, waiting for someone to read it the way Marion would have read it in anyone else's chart. Renee visited that evening, straight from work, still in her blazer from a deposition that had run long. She found her mother sitting upright, uncomfortable, a blood pressure cuff still strapped to her arm from 2 hours earlier that nobody had come back to remove. "Has anyone actually looked at you today?" Renee asked. "They looked," Marion said. "Looking isn't the same thing as seeing. Mom, you need to tell them who you are. Actually tell them, not just answer their questions politely and wait." "I have told them, Renee. I told the nurse this morning. I ran cardiothoracic surgery on the 4th floor of this building for over 2 decades. She smiled at me, the way you smile at someone's grandmother telling a story at Thanksgiving. Renee sat down hard in the visitor's chair, the fight going out of her for a moment. "I don't understand how that's possible. How does nobody here know who you are? Because I retired 8 years ago, and I never once asked anyone to remember my name after I left. I didn't do this work to be remembered, baby. I did it to be useful." She adjusted the blanket over her own knees, the same brisk, unhurried motion Renee had watched her make 1,000 times at 1,000 other bedsides that weren't her own. "I just never expected to need the memory back. So, tell someone with authority. Ask for the charge nurse. Ask for whoever's above her." Marion was quiet for a moment, and when she spoke again, some of the fire had gone out of her voice, replaced by something wearier. "I spent 40 years teaching myself exactly how much I was allowed to push before it got used against me instead of for me. Old habits don't retire just because I did. I'm a doctor, baby," she added a moment later, softer. "I know exactly what's happening in this room. I've just never been the one lying in this particular bed before." Renee found a nurse in the hallway and asked, as evenly as she could manage, whether someone could come check her mother's pain medication schedule. The nurse, not Whitfield, one of the evening float staff, said she'd let the primary nurse know, and by the time Renee left for the night, no one had. Before she left the building, Renee stopped by the patient advocacy office on the 2nd floor, more out of professional habit than real hope. She'd spent enough years in courtrooms to know the value of a paper trail, The office was closed for the evening, a laminated sign directing her to call a general line during business hours. She called the next morning from her own office between meetings, was placed on hold for 11 minutes, and eventually left a message describing her concerns to a voicemail box that, as far as she ever learned, nobody checked before the events of the following afternoon made the message entirely beside the point. If you've ever watched someone you love get smaller and more careful in a room because raising their voice felt like a risk they couldn't afford to take, you already know exactly what that night cost Marion Hayes, and exactly why she didn't take it. The second morning brought a new attending making rounds. Quick, overworked, glancing at two charts that looked clinically similar enough not to require much extra thought. He asked Margaret how she was feeling and adjusted her medication slightly upward when she mentioned some lingering discomfort. He asked Marion the same question, got the same kind of answer, and moved on without adjusting anything at all, trusting the nursing notes in her chart more than the woman actually reporting the symptom. Whitfield's notes that morning read, verbatim, "Patient reports discomfort, appears comfortable on observation, monitoring." Margaret's notes from the same morning read, "Patient reports moderate pain, medication adjusted per patient report." Sarah Kim, still turning the discrepancy over privately, pulled both patients' full charts that evening out of simple stubbornness and found the pattern went back further than 2 days. Whitfield's documentation style, reviewed across a full month of shifts, consistently ran shorter and more dismissive for a specific handful of patients than for everyone else on the floor, a detail that would matter enormously in about 18 hours and meant nothing to anyone who could act on it yet. 2 women. 2 nearly identical arrhythmias. 2 entirely different sentences describing what each of them had said with their own mouths. By the second afternoon, Margaret Cole had started noticing things she didn't have the vocabulary to name yet. The way the same nurse who fluffed her pillow twice a shift barely glanced at the woman in the next bed. The way her roommate's water pitcher sat empty for hours, while her own got refilled before she'd even finished asking. She'd mentioned it once, gently, to an aide passing through. Is someone checking on her too? And gotten a vague, non-committal answer that told her nothing and everything at once. She didn't know yet what she was watching. She only knew it made her uneasy in a way she couldn't quite justify to herself. That afternoon, Marion called Renee during a lull, keeping her voice light in the specific way mothers do when they've decided their children have enough to worry about already. "Just checking in, nothing new. You sound tired." "I'm in a hospital bed, baby." Tired comes standard. "Do you want me to come back tonight?" "Get some sleep instead. I'll see you tomorrow." She hung up before Renee could hear the small catch underneath the reassurance. The same one she'd spent 40 years teaching other doctors to listen for in their own patients, and had never quite learned to let anyone hear in herself. Alone afterward, Marion did what she'd always done, with a case that worried her. She ran it the way she would have run it for a resident presenting to her on rounds, out loud in her own head, methodically. 71-year-old female, history of untreated intermittent arrhythmia, admitted for observation, now reporting new and escalating symptoms not being adequately addressed. Recommend immediate reassessment. She would have flagged that patient for an urgent workup without a second thought if anyone else had presented the case to her. She almost laughed at the strangeness of it. 40 years of trusting her own clinical judgment completely, and here she was, the one case she couldn't get anyone else to take as seriously as she would have. An hour later, her heart rate had started climbing in a pattern she recognized immediately and completely, because she'd spent 4 decades reading exactly this kind of number off exactly this kind of monitor for other people. Rapid, irregular, climbing past 110, then past 120, her own pulse hammering somewhere behind her ribs in a rhythm that had stopped being merely uncomfortable and started being genuinely dangerous. She pressed the call button. 4 minutes passed. She pressed it again. Whitfield came in eventually, glancing at the monitor from 3 feet away rather than actually reading it. "It's probably just anxiety," she said. "New environment, unfamiliar bed. Try to relax." "I need you to look at the number," Marion said. "Not guess at it, look at it." "Ma'am, I've done this a long time. I know what anxiety looks like." "I'm not anxious. I'm telling you what 128 beats per minute, irregularly irregular, means in a woman my age with my history. I need someone to page cardiology." Whitfield's expression shifted into something almost amused. "You're not a doctor, ma'am." "I am, actually," Marion said. 41 years. Cardiothoracic. I ran the surgical service 2 floors above this one for over 2 decades. Whitfield didn't believe her. It wasn't even active disbelief so much as the number simply failing to register as a possibility worth pausing for. An old woman in a hospital gown saying she used to be a surgeon slid past Whitfield's attention the same way most of what Marion said had been sliding past it for 2 days. "I'll note your concern," she said, and turned to check Margaret's water pitcher on her way out. Because Margaret had also pressed her call button 30 seconds behind Marion's second attempt, and gotten there first in every way that mattered. The monitor kept climbing. 131. 131. Margaret watched the number over her roommate's shoulder from her own bed, watched Marion's face go from concerned to genuinely frightened in a way that finally gave her earlier unease a shape she could act on. It was Margaret Cole, in the end, who saved her roommate's life, in the only way available to her. She watched Marion's breathing change, watched her go pale and press one hand flat against her own chest, and hit her own call button without stopping to ask permission from anyone, shouting into the hallway herself when the light alone wasn't fast enough. "Somebody get in here. Something's wrong with her, right now, not in a minute." A different nurse responded this time, took one look at the monitor, and called a rapid response before she'd even finished crossing the room. The overhead page went out across the whole floor. Feet started moving in the hallway with a very different urgency than they'd shown for the past 2 days. Marion lay back against the pillow, her own trained mind still narrating clinically underneath the fear. Some detached part of her cataloging her own vitals the way she'd cataloged 1,000 other patients' numbers, while a much less detached part of her simply thought, "I told her. I told her exactly what this was, and she still didn't look." If you've ever said the true, correct, specific thing out loud to someone who had every reason to believe you, and watched them decide not to anyway, you already know exactly how it feels to lie in that bed doing the math on how much time you might have left to be right. The rapid response team hit the door within 90 seconds of the page, and the doctor leading them into the room was Dr. Elijah Bennett, 48 now, chief of cardiothoracic surgery at Ashford Memorial, the same service Marion Hayes had built and run for over 20 years before he'd ever set foot in it as anything other than her most nervous resident. He crossed to the monitor first, the way he'd been trained to, reading the rhythm before he read the patient. 136, still climbing. Blood pressure beginning to drop in the specific way that told him this had gone past uncomfortable and into dangerous territory some time ago. Then he looked at her face, and something in his own expression rearranged itself entirely. "Dr. Hayes?" "Elijah," she said, and even mid-crisis, even with her own heart trying to shake itself apart in her chest, something in her voice eased at the sound of a name she hadn't had to explain herself to in 2 full days. "Talk to me. When did this start? 90 minutes, maybe more. I called for help 40 minutes ago." Something flickered across his face. Not shock exactly, closer to the specific fury of a man doing very fast math on how close he'd come to losing her, before he'd even known she was in the building. "Push diltiazem, 0.25 milligrams per kilogram over 2 minutes, he said, already reaching for the leads himself to confirm the rhythm on the strip. "Get me a 12 lead. Somebody find her old chart. I want her baseline ejection fraction, if imaging has it archived." A nurse he trusted completely had the medication drawn before he'd finished the sentence. He didn't waste the next several minutes on anything but the emergency in front of him. The room filled with staff now, orders called out in the clipped shorthand of people who trust each other completely. Medication pushed through the IV line, the rhythm brought back under control through the exact kind of coordinated, competent, immediate care that had been sitting 4 feet away from Marion Hayes' bed for 2 days without ever quite reaching her. Within 11 minutes, her heart rate had come back down into something survivable, then something normal, then something merely tired. Only once she was stable did Dr. Bennett turn around and ask the question every person in that room had been quietly avoiding since he'd walked in. How long has her heart rate been elevated? Nobody answered immediately. Dr. Sarah Kim, who'd followed the rapid response team in, was the one who finally spoke. I noticed a difference in her care, starting yesterday morning. Response times, documentation. I raised it with the charge nurse last night. She held up her phone, the photo of her folded sticky note still saved to it, the 2 timestamps, 2:14 and 2:31, that she'd never quite been able to talk herself out of keeping. I have the exact times, if it helps. I wrote them down because I didn't trust myself to remember them accurately otherwise. What was the response? That the primary nurse had 19 years of experience. Bennett pulled the chart himself. He read Whitfield's note from that morning. Patient reports discomfort, appears comfortable on observation, against the monitor's own timestamped data, showing a heart rate that had been climbing for over 90 minutes before anyone called for help. He read Margaret Cole's chart beside it. Medication adjusted per patient report, logged within minutes of an identical complaint. He flipped back another page and found the echocardiogram order, delayed a full day and only completed because a second-year resident had walked the paperwork down herself. He didn't raise his voice. He'd learned that from the same woman lying in the bed in front of him, decades earlier, the same year she'd made him re-scrub 4 times for a valve repair. Quiet was what actually made people listen. "Nurse Whitfield," he said, when she was called into the room, "walk me through your assessment of this patient's condition over the past 2 days." "She seemed stable," Whitfield said. "She was reporting some discomfort, but nothing that read as urgent on exam. Her heart rate was 134 beats per minute for at least the last hour before this room called a code. You documented her as comfortable 40 minutes into that climb. You didn't think she was telling the truth," Bennett said, still quiet, still even. "I've been doing this 19 years, Whitfield said, some of her composure finally cracking. "I know how to read a patient." "Then read this one," he said, and turned the chart so she could see both pages side by side. Margaret's and Marion's, the same complaint on the same afternoon, 2 entirely different responses beneath it. Because the woman in bed 1 got a medication adjustment for the same complaint you wrote off as anxiety in the woman in bed 2. He set the chart down. "This is Dr. Marion Hayes. She ran this service for 22 years. She trained me, she trained the chief of staff. She has forgotten more cardiology than either of us will ever know. And for 2 days, this hospital let her lie in a bed, asking to be believed." The room had gone fully silent. Whitfield's mouth opened. Nothing came out. 19 years on that floor, and she stood there working her jaw at a room that had gone completely still and produced not one single word in her own defense. Word moved through the unit inside the hour, the way it does in any building full of people who all just watched the same thing happen. Aides who'd walked past Marion's call light without a second thought 2 days earlier now found reasons to check on her themselves, bringing water she hadn't asked for, adjusting her pillow with an attentiveness that arrived roughly 48 hours too late to feel like anything but guilt. One of the evening float nurses, the one who'd told Renee she'd passed the message along and then hadn't, asked to speak with Marion privately before the end of her shift, and stood in the doorway for a long moment before she could actually make herself say she was sorry. By the next morning, 2 other families on the floor had separately mentioned, unprompted, that they'd noticed something similar with their own care over the past year, and never known who to tell. The hospital's chief medical officer came up to the fourth floor personally that same afternoon. A woman named Dr. Patricia Alvarez, who had crossed paths with Marion exactly twice in 20 years of overlapping careers, and remembered both occasions clearly. She sat at Marion's bedside for 20 minutes, not as an administrator managing a liability, but as one physician sitting with another, and left with a legal pad full of notes and an expression that suggested several people below her were about to have a very uncomfortable week. When Sarah Kim mentioned, almost as an afterthought, the month-long documentation pattern she'd pulled the night before, Alvarez asked her to send it over before the day was out. The kind of quiet, specific detail that turns an isolated incident into a pattern a review board can't easily dismiss. The patient relations office opened a formal review by that afternoon. Nurse Whitfield was placed on administrative leave pending investigation before her shift even ended. Walked off the floor by the same charge nurse who'd told Sarah Kim, less than 24 hours earlier, that 19 years of experience was answer enough. If you've ever wondered what it takes for a system to finally believe someone it had every reason to believe 2 days earlier, you just watched the answer. And it wasn't complicated. It just required someone with enough standing in the room to finally be listened to. Marion Hayes recovered fully over the following week. Her rhythm stable, her care after that morning, meticulous in a way that made the previous 2 days feel almost like they'd happened to someone else. Dr. Bennett checked on her personally every morning before his own rounds began, the same nervous resident underneath the chief of surgery's title, still slightly in awe of the woman in the bed even now. "You could have told them who you were on day one," he said, on one of those mornings. "I did tell them," Marion said. "Nobody asked me to prove it, because nobody thought there was anything worth proving. That's rather the entire point, Elijah." He sat with that for a moment. "I keep thinking about how close that margin was, 90 minutes, maybe less, before it stopped being reversible." "Then make sure the margin's wider for whoever's in that bed after me," she said. "That's the only apology I actually want out of any of this." The hospital's review took 6 weeks. Nurse Whitfield did not return to the cardiac floor, and did not return to Ashford Memorial at all once the review concluded. The findings weren't made public in full detail, but the hospital instituted a mandatory bias training module for all clinical staff by the end of that quarter, cited 2 prior informal complaints against the same nurse that had never been formally logged, and revised its policy on delayed diagnostic orders to require automatic supervisor review after 12 hours. Dr. Sarah Kim was specifically commended in the report for raising a concern that had, in the end, been entirely correct, and was invited to sit on the unit's newly formed Patient Equity Committee, an invitation she accepted the same afternoon it was offered. The hospital board, in the same quarter, established a small annual scholarship for first-generation medical students in Marion's name. Modest as these things go, a few $1,000s toward tuition, nothing close to what her career had actually been worth to the institution. Marion insisted on reading every applicant's essay herself each year, rather than let the committee choose without her, and made a point every single time of picking at least one student whose file, on paper, looked exactly like the kind the admissions committee had once rejected without explanation. Marion came back to Ashford Memorial 3 months later, not as a patient this time, but as a guest speaker at the hospital's first mandatory training session on documented racial disparities in patient care. She hadn't wanted to do it, at first. She'd spent a career being examined and had no particular appetite left for being made into a lesson. Dr. Bennett asked her twice before she agreed, and only on the condition that she wouldn't be introduced as a cautionary tale. She stood in front of a conference room full of nurses and residents, some of whom had been on shift the week she was admitted, and told them almost none of the anger she still carried. She told them instead about the boy pulled from a highway wreck with his aorta nearly torn through, and the daughter he'd named after her, and the 4 hospitals that had said no before she'd said yes. Then she told them, plainly, what it had felt like to lie in a bed on the 4th floor of the hospital she'd built, pressing a call button, watching a number climb on a screen, and not being believed. "I am not a special case," she told the room when she'd finished. "I had a former resident with the authority to walk through that door. Most of the people this happens to do not. That's not a story with a happy ending. That's just the version you happen to hear about." Nobody in that room clapped when she finished. A few of them, Sarah Kim included, told her afterward that they'd needed the silence more than they would have needed applause. Margaret Cole sent Marion a card, 2 weeks after they were both discharged, on plain stationery. No return address needed since neither of them had forgotten the room number. It read simply, "I should have said something sooner. I'm glad I said something when it counted." Marion kept it in the drawer of her kitchen table, next to the tea things, and the two women had lunch together twice that following spring. An odd, quiet friendship neither of them had expected to come out of a hospital room. At the second lunch, Margaret asked her, carefully, whether she'd been angry at her for not understanding sooner, for taking 2 days to notice what should have been obvious from the first afternoon. Marion considered the question the way she considered most things, without rushing toward the easier answer. "I've had a lot of practice being patient with people who are only starting to see something I've had to see my whole life," she said. "That's not the same as forgiving the hospital for it. But you're the one who pressed that call button when it mattered. I don't forget who did that either." Renee visited every Sunday afterward, the way she always had, except now she stayed a little longer and asked a little more. And neither of them pretended anymore that a hospital gown made her mother any less the woman who'd spent 40 years making sure other people's mothers came home. Here's the thing worth sitting with. Long after the monitor's alarm and the rapid response call have faded from memory, the myth that got Marion Hayes nearly killed in her own hospital is centuries old, and it never needed anyone to say it out loud to keep doing damage. It just needed one person, in one room, to decide a number on a screen wasn't quite worth believing when it came from her. Being right isn't always enough to be heard. Sometimes it takes someone else walking into the room who already knows exactly who you are. So here's the real question. Have you or someone you love ever had to fight to be believed in a room where you were telling the plain, simple truth the entire time? Tell us in the comments. If this story stayed with you, we've got more real stories like it coming. Subscribe to Karmaline Stories so you don't miss the next one.